Welcome to another episode of Chasing Creativity. This is Kiran Manral. Today I'm delighted to have with me as a guest on the show Dr. Chintaman Suvarna, who's an MD dermatologist, trichologist, hair transplant surgeon. And we're going to chat about all things that make you beautiful. Welcome to the show, Doctor.
Thank you for having me, Kiran.
I've always been curious, given that the space of face and hair is so prominent now, with everyone wanting to look their best, and you've been working with some known, unknown faces. What is the most common request that you keep getting?
So when patients do come to me with their little concerns, most important one is that they come with such fabulous details. I want to look a certain way. They get photographs and they get pictures and they get videos of certain people and they show ऐसे कर दो वैसे कर दो. It's not supposed to, I cannot actually design a human being, but we can obviously fix certain things. For example, I can fix an under eye, I can fix a jaw filler, and all of these details. So these certain aspects are very important, like when it comes to facial corrections through fillers or Botox. So like these are all the small concerns that I can fix a jaw for you. I can fix a mid face if you have a droop there or an under eye cavity. But I cannot make you look a certain way, which is a far distant.
So that will go into the realm of actual surgery, plastic surgery.
Again, even plastic surgery, like if you are talking about blepharoplasty or a brow lift or any kind of a surgery, again it has a certain limitation because it can remove a piece of fat pad, or it can suture, or it can align. Even bone surgeries, like there are some they can carve a bone niche for you, but that is a different. Doesn't come under Botox and fillers, but yet you cannot reach an ideal this thing. So you should make your expectations quite realistic, is what I feel with Botox and fillers.
So do patients come in with realistic or unrealistic expectations?
Most of them are unrealistic. So obviously tell them ki you have to get a realistic opinion ki you're going to expect this out of this. And whenever I have worked with patients, I've always seen to that I have underworked. Like always it's better to undercorrect, because if you overcorrect, you cannot, it's going to be a very pathetic and a shabby work done. So always undercorrect, and you can always tell the patient to have a lot of water, because hyaluronic acid absorbs well in you when your water intake is much more.
Okay.
So that's when you realize that the filler is going to take some time, but then over time it does absorb and it shows results.
Talking about overfilling, we've seen a lot of faces in the public gaze which are really visibly done, so to speak.
Yep.
What goes wrong here? Is it the patient saying, okay, I want more, or is it the doctor not seeing a way to stop and say, no, that's enough? What happens in these cases?
So I would say
we can take names.
Yeah, sure. So I think it can happen in both ways. Like the patient is also asking for more fillers, or the doctor also wants a certain kind of work done. Like even he wants more amount. He feels there's a misjudgment. Like there can be more amount of fillers which is put in than what is actually required. But in such cases, what happens is sometimes the patient is happy with a certain look.
Okay.
I've seen patients happy with the botched up work, but they want that lips.
Okay.
The patients have come कि मुझे ऐसे lips चाहिए. Or
the lips that walk into the room before they do?
Yes.
Okay.
People have asked, I want like those those plastic lips. They want it. So, but then yet again, then we take a written assurance from them that we are not responsible for whatever happens to you or your lips.
Okay. There was something very interesting we were chatting about the other day, which is you spoke about the perfect face and the perfect facial symmetry.
Right.
Would you care to explain that?
So in symmetry, as I said, when it comes to aligning a face, so basically whenever a patient is even pitched for a filler for me, the patient walks in only, I analyze कि मुझे क्या क्या काम करना है इस पे. So symmetry, as in the face is divided into three parts: the upper face, the mid face, and the lower face. They all have to be in symmetry. Supposing the lower face lacks symmetry, then I have to give the symmetry to it. So it's 1/3, 1/3, 1/3.
Okay.
In equal dimensions.
Okay.
So upper face, mid face, and lower face. So the lower, it has to be 1/3, 1/3, 1/3. If it's not, then I will give it.
So there was some research that I read somewhere about it's not actually the exact features. Faces which are the most symmetrical are perceived as beautiful. Is that true? Does that hold true?
Yes. So basically, when we call somebody beautiful, it is actually the symmetry what we admire. So anything, the symmetry is beauty. Like it's that is almost an equivalent term.
Okay.
So even if the patient, even if the person is of any complexion, even if whatever age, if they have a symmetrical dimensional face,
Mm-hmm.
then they tend to be more beautiful.
That's very interesting.
Hmm.
And in your practice, have you come across anyone with this one third, one third, one third symmetry occurring naturally?
See, by the time the people whom I deal with they are usually above 35 years of age.
Okay.
So by the time the symmetry
Is
is
gone.
gone,
Tell me about it.
yeah. So after that age, so you have to get the symmetry done.
Back. Okay.
Work is done. Talking about names, I'll tell you, Preeti Sinta, fabulous work done.
Okay.
Perfect jawline done. Perfect hair. The everything done quite nicely.
Mm-hmm.
So it is a very good amount of work and very nice work which is done.
Recently, we had Rajkumar Rao who got quite a lot of flack because of fillers done in his jaw.
Yeah.
Do you think it was warranted?
So again, what happens is, this is what I am different as compared to other injectors. What other injectors do, they want it shown in the paper. They want it shown but I always believe in aesthetically appealing work. Yet it should not be that my client should not be outshowed and spoken about कि इसने कुछ कराया है.
Mm-hmm.
It should not be. It's a subtle work, like fine work. Like those wrinkles, those lines will go. The face will become more dimensional and more healthy. Such cases, what happens? It's out and about. Like you have done pathetic work. The work, the filler is all over the face and everything. So, you tend to overjudge that person.
Mm-hmm.
So, what I do is I use less amount of products, good amount of judgment as to where am I injecting, whether it is the jaw, whether it is the chin, etc. So a judgment, and when you're actually procuring the filler, you should understand that where am I supposed to use the minimum amount of product to get the best result.
Okay. And now, when you are looking at a patient and you have a certain vision for how you want the patient to look at the end of it all, and perhaps the patient has a different vision, then how do you sort of reconcile the two? Are you compelled to give in and do what the patient wishes?
No. In the OT, I'm the boss. I feel. I do not listen because what will happen? No, after a while they will come back to me. So ये ऐसे हो गया. So that at that point of time, I do not believe and I consider their opinions and I tell them कि ऐसा होने वाला है आगे जाके. So
So I see a lot of people now. We had recently famous something Lives of Bollywood Wives, that
yeah.
show, in which they were getting all sorts of treatments done on their face, and now we had the Urfi Javed show, Follow Karlo Yaar, which showed her going into her dermat's clinic and actually getting the fillers and the Botox and whatever done. She's 25.
Right.
And I don't know, but Doc, you're the best person to tell us. Is it advisable to start getting stuff like Botox and fillers done when you're 25?
See, Botox is a botulinum toxin,
It's a toxin.
which is injected to paralyze a muscle, okay, in which there are excessive fine lines are seen. You inject so that the muscles are paralyzed and you don't see those lines. These people are exposed to camera to a great extent. The camera focuses a lot, right? So they do not want the slightest of the line seen. I do not advocate this. These products have to be used after a certain age.
And what is
only.
that certain age?
After 35 plus.
Okay.
See, under eye filler, under eye correction can be done before that because people have eye bags at any age group. So I have done under eyes for a 25-year-old, 28-year-old.
Okay.
But other fillers can wait, I feel.
Okay.
Because the facial symmetry and the bone resorption and everything has not happened. So I think that can wait.
So this entire trend of getting work done and getting fillers done and people doing Botox when they're still in their 20s, mid-20s is not something you'd advocate at all. We're getting into an age because we're so much on Instagram, and I think it all took off really after COVID when we were all on Zoom calls all the time and we had to see our own faces. So this sudden desire to look good percolated down from, you can correct me if I'm wrong, from the people from the glamour world to everyday normal people.
Right.
And it's become I think it's become very commonplace now. Most every person is getting it done. It's regular. It's not just a certain category of society. How healthy or unhealthy is it? Do you see people getting obsessed by coming in and doing work over and over again? Do you see that happening?
See, yes, yes. So basically, it is addictive. Once the work speaks for itself, it is kind of addictive, no doubt about it. But what happens is this is supposed to be done after a year and a half. What happens? So many patients come to me. Doc, I need a touch up. I said, you don't need a touch up as yet. You can see me after 3-4 months
Okay.
because I tell them ki the work has let it resolve properly, and when it is showing evidently, then I will give you a touch up if required. That is.
Okay.
So right away, I don't think you need it. So I do not advocate it at that time.
Okay.
So there you have to keep this thing like
But that's from doctor to doctor.
yeah.
There could be some doctors say, yes, please let the cash registers ring.
Yeah, there are people everywhere in all types of society, in all types of professions. But yeah, so I do not advocate that at all.
What would you tell
Uh,
people who are looking to enhance their appearance through fillers, through Botox, to whatever injectables? We're talking about injectables here, not about procedures.
hmm.
Are there any warnings, guidelines, anything you'd like to put out there for them to know
Hmm.
in terms of what you're getting into?
See, first and foremost, you are not supposed to follow your friend's fa- skin routine. If she has done Botox, you're supposed to get done Botox. No. If she's undergoing a salicylic acid peel, you're not. No. Your skin is different. Your condition is different. You are not qualified enough to understand what is going on.
Mm-hmm.
See a dermatologist. See a skin specialist. He will do the work for you. He will analyze your face. He will decide how much product has to go, and then he will accordingly inject or do the procedure. So you shouldn't analyze for yourself. You shouldn't self-medicate and self-treat. And now in this day and age, there are so many quacks. Like for now, I can show you my degree. There are so many people, so many, even people who are, I don't want to name them, but they're actually dealing with celebrities. Top-notch celebrities who are not dermatologists. So there's a lot of quackery in this industry, which needs to be taken care of. But so you have to understand whom you're going to.
Okay. Demand to
So
see the degree.
yes, in fact, NMC guidelines have shown that we have to put it up on the wall.
Yeah.
Every patient who walks into your clinic has the right to see it. So before you see, if you must have gone to any other doctor also, you
It's on
see
the,
it's on the wall.
it
The
has to be on the
degree,
wall.
the registrations, the certificates, everything is on the wall for the whole public to have a look at it.
What could go wrong? You know, when I worry when it's something like a face, which is like on display all the time. And you go to, as you said, somebody who's a quack who's probably just assisted an MD and doing this and then started off on their own.
Yep.
What could go wrong? What are the things that could go wrong?
See, 2 3 things: minor complications, major complications. So in minor complications, when we deal with mild bruising,
Okay.
mild kind of bumpiness around the filler, that is all mild, nothing to worry. It'll settle without intervention. You
Okay.
don't have to actually speak about it or work on it. No, it'll go.
Okay.
But certain serious complications, very rarely, it can cause the filler can enter the blood vessel. If
Okay.
it enters the blood vessel, it'll clog it. It can cause necrosis of the skin, localized necrosis,
Oh, ma.
and
Okay.
very, very, very rarely, even blindness.
If it is in the.
The filler might enter the retinal artery and can cause blindness. See, in such cases, in anything at all, like even if normal procedures, go to a hospital and get even an IV line done, they take a consent. So even the worst case scenario, anything can happen. Even a needle like a tetanus injection can cause anaphylaxis to you, can cause death also. That has been reported. So what happens is, so over time, very serious complications can occur anytime.
I think I read about this about somebody who got went blind after she got Botox done, but
Botox.
or
Okay.
something done around the eye
Yeah,
area.
okay.
But this sort of jogs my memory to that.
Yeah, yeah.
And it was irreversible because apparently the nerve had got totally blocked or
Right,
something.
right.
So these are the scary things that you need to watch out for.
Hmm.
Now, as somebody who is a doctor, but working in a very aesthetic space,
Right.
where does your creativity come into focus? Because this is a creative podcast.
Yes, yes. So for me, my patient's face is like a canvas for me. So when I work, I see to that what am I going to deliver? what my patient's expectations are, and I analyze the face accordingly.
Hmm.
And I am not a very commercially oriented kind of a doctor. Not saying it for saying it, but for supposing what I feel is I deliver a good result, the patient will get me another patient.
Hmm.
I don't have to advertise. Now, if I botch up a patient for the commercial gains of it, I'm never going to get another reference from that patient. I'm never going to have that reference chain and the patient build up. So here, some doctors, even any other professionals, they tend to get into the greed and get the work more. But what I feel is get work done nice, sophisticated niche work done.
Hmm.
Like the work should speak for yourself.
Okay.
Like when I see a patient with a cutting jawline, which I have made, it gives me a boost. It gives me a happiness because that line which was there on that same face 20 years ago, I have given it.
Hmm.
That jawline which disappeared, obviously because of bone resorption. So that gives me a kick. So
Okay.
that is my creative input towards a face. When I make a face, so basically when I design a particular face, I understand that this is something which I could do because of my skill set.
Hmm.
So this gives me a happiness.
Lovely.
Yeah.
What are the most popular procedures that get asked for?
So primarily Botox, fillers, more importantly now profilos.
Okay.
So they are and skin boosters as well.
Could you tell us a bit about Profilo? What it's
So
about?
Profilo is basically a company. So they are all skin boosters. So basically they help in collagen regeneration, acute fine lines which are there on the face, disappearance of those lines, and increase in skin vascularity and all small components gives you a glow on the face. Even neck, even those small necklines which disappear over time, all of these also help to a great extent.
Okay, so that's what happens with Profilo.
Yes.
And like the fillers and all is Profilo, something that needs to be redone every some months.
Yeah, so basically again person to person. Some people do not need a filler to get done for about 1.5 years. Some patients need it about 8 to 9 months.
Okay.
Person to person and according to the metabolism of how the filler is being metabolized. I mean, so all of that makes a lot of content. And more importantly, I've always tell, तुम पानी ज़्यादा पियो, filler ज़्यादा टिकेगा.
Okay.
So whenever I tell no patients, drink a lot of water.
Okay.
So that is automatically going to garner that the uh, filler is going to stay for a longer time.
Okay. So this drink a lot of water will hold good for those who've not had fillers as well, I guess.
Yeah, so basically that will hydrate your skin and always help you either way. So drinking water will obviously keep you hydrated and keep the filler intact.
Okay.
Either
And
ways.
how much water would you advocate?
When the work is being done, minimum 4.5 liters.
And for
Either
regular
ways,
people?
3.5 to 4 liters. A little more when you're getting your work
So
done.
4 is like your mean.
Yes.
Okay. That's a lot of water, doc.
But to have a good skin, I'll tell you one thing. Many people say, "What is the skin routine?" And this thing, I also have a good skin. But most importantly, other than the sunscreen, I'm just drinking water.
Okay.
So if anybody asks me my routine, it's sunscreen and water.
You know, I'm very envious. You've got great skin, of course. My husband,
Huh.
you've met him.
Yeah.
He just doesn't apply a thing on his face, just splashes water on his face. His skin glows. And here I am with serums and this and that and spending like a king's ransom on all these things. Of course, now I've stopped since you've
Yeah.
told me
Yeah.
what has to be done. But I was spending so much money and all that and nothing compared to that. So, how much of a role does genetics play in this entire thing?
See, what happens is depends on how much of the skin in the male skin is tend to be more
Thicker?
thicker as compared to the female skin, and what happens is they are used once you like make your skin used to something, you are like resistant to it. It's just like how and like if you're used to like if you're drinking not boiled water, you get used to it. So somebody who's not having it will have diarrhea the other day. So it depends on that also, and it's genetics. Of course, it is genetics because and aging process for males and females are somewhat different.
Okay.
So when it comes to females, it is because it's also hormone related. It's not as hormone related as compared to this. And fat pad loss, the fat which is the subcutaneous fat, is lost more in women
Women.
as compared to
Okay.
men.
So that accelerates the aging
Yes, and that's the
appearance
reason we have lesser amount of male patients coming for
for
fillers.
fillers.
Though I have done very good filler work for male patients also.
Okay.
So, but
Again, nature's also being unfair with women, making us spend more on fillers. That's interesting. Now, when you're talking about, you spoke about water as an essential component of skincare. For those who are watching as a dermat and somebody who's in this space and working, what are the most common skincare mistakes that you see people making?
so what happens is most of the people apply acids like glycolic acid, salicylic acid, sometimes even at home without proper indication.
Like medical degree, medical level acids,
Yes,
not
yes,
the
yes,
serum
yes. Yeah,
formats.
12% by it's a depigmenting agent. Salicylic acid is the only acid which is allowed in active acne.
Okay.
You're not supposed to apply glycolic acid on active acne. See, if it was that simple, there wouldn't have been an MD
Need.
degree, and I wouldn't have to study 10 years to be here after 12 standard. So if it was that simple and you would get everything over the counter, so it would not have been that simple. So everything is an indicated and not indicated. Even though I take the decision in a fraction of a second, the ability to come there has taken me 10 years after my
Absolutely.
12th.
Absolutely.
So
So
that
they use acids, strong acids at
they
home.
use acids, they use sunscreen with SPF 30. SPF 30 in Bombay is as good as don't use sunscreen. I always tell them 30 35 का जो SPF का use मत करो.
Hmm.
Because Bombay, the amount of sun, the UV radiations Bombay has, anything below 30, anything below 50 is used less.
Anything below 50.
Yes.
So you recommended something that's a 55.
Yes, 50 to 55. So I am more of that sort.
Okay. Sunscreen, don't use acids without getting a doctor to tell you what you have to use. Any other things that people are messing up their skin with?
Yeah, you're not supposed to apply all that on the face. कुछ भी लगा देते हैं, कुछ भी.
Yeah. But you keep getting seeing all this like haldi and besan and dahi lagao, and I became
वो हल्दी
fantastic.
बेसन सब मिला के भजिया बना दो उसका. उससे अच्छा, rather than applying it on the face, it's useless.
Okay.
Even if it has, because it's going to have a lot of irritants. Even if one or two if acts as an irritant, no, it's going to cause irritant contact dermatitis, and it is going to cause a hell lot of a tuss to get it done. So what happens now? These people do all their home remedies, they go to quacks and everything, and then they come back to dermats. ये हो गया है मेरे साथ, अब ठीक करो. I've literally sat with lasers and got those pigmentations removed.
Oh
With
God.
those, what has happened because of,
Applying all this stuff on
yes,
your face.
yes.
I must tell my mother-in-law this because I think for morning, she starts in the morning and she will be applying papaya, coconut water, then something else which she has ground, some orange peels.
You can might as well apply a vitamin C peel. Go to a clinic, they'll analyze your skin. If you want the citrus effect to enter, the citric acid to enter your skin, might as well apply vitamin C serum.
Okay, I will tell her this. But I think she enjoys the process of applying everything. So
Force
it's,
of habit. Indians are force of habit. What happens now? Once you've seen people do it, do it, do it, they won't stop it.
but I think it's something that they've been doing for so many years. So they just continue. It's also that lime water and glycerine and rose water mix. I don't know if you know about this because the older generation is applying that like crazy. That's a must in their skincare routine.
See, anything which does not corrode your skin.
But that's got lime juice in it.
Yeah, again, it's a citric acid. So anything which does not corrode your skin in greater concentrations, you can apply. Like a cleanser is best, no? Use any company's cleanser which is FDA approved. Use it. You can use it. There's no point in applying anything which is not this thing indicated, because it is going to cause you complications.
Okay.
I've seen all sorts of complications.
There's something I'm very curious about because, we are in an Instagram age with everybody being a beauty influencer and putting up all sorts of reels about various products. And this whole 7-step, 10-step K beauty routine. What are your thoughts on this? Because I've seen people putting serum, essence, toner, this, that. In the night, they'll put on 10 things, then they'll put a sleeping mask on top of that.
And
Does this
still you look
work?
so bad after. People look so bad after applying all of that. I've seen, no, you have 10 skin routine, had the worst. Like if you look at them, I have this routine. Patients come to me and they say, I have this month, ये मैंने ये apply किया, वो apply किया. नहीं काम चल रहा है ना तो रोक दो. That is a sign that the routines are not working. For a basic skin routine is first and foremost, when you're applying, first and foremost clean your skin. The first layer should be vitamin C serum. After that, this is for a middle-aged woman after 35. Vitamin C serum, moisturizer, last coat of sunscreen. That's it. You
That's it.
don't need any other routine. Vitamin C is for collagen, moisturizing is for dryness, and sunscreen is for protection. You don't need to apply anything.
This is the
else.
morning routine.
Yes.
In the night, then you add a retinol to this.
Retinol to this. Perfect.
No vitamin C in the night.
No. Vitamin C can be can be applied in the evening if needed.
Okay.
And retinol only at night.
What are these companies going to do if people are going to pare down their routine so much?
What happens? And this is that's what. No, there are so many. They're telling anything unadvocated stuff. See, dermatology has been such the encroached kind of a field. Everybody wants to be a dermatologist. Nobody wants to study like a dermatologist.
I mean, hats off to you guys who studied 10 years after and
After my 12th grade. Yeah, so, and derma is very difficult to get in also. Like, we had very few seats. So, it is some things like you're not supposed to do. I've told my patients, I'm not supposed to do. There are patients who have come and said that I've been applying this powder, some vibhuti or something on their face. Then I told you, give it to me in writing that you're going to apply this vibhuti and I'm not going to come to me with the complications of this vibhuti.
Vibhuti?
Yeah, some powder.
Are they becoming sadhus and smearing ash all over? What is this?
Because they are used to certain, they are used to, what happens is, it camouflages. Like if sunscreen is giving a good result, they'll blame it on some, anything which gives a good result, not first they'll blame it on their own home remedies, not on the dermats they're coming to.
What a pity. What about hair? How are we goofing up with our hair? And plus, a lot of people are having, you're a hair transplant surgeon yourself. You see a lot of cases and you do a lot of transplants. And people are starting very young. They're losing hair very young. Why is this happening?
First and foremost, this day and age, stress, androgenetic alopecia is at its peak. So people are losing hair from the center, from the crown area and everything. So first and foremost, try to control the stress. That is like I know I'm talking in the air. It's not that easy to control, but still, stress, lifestyle, food habits, all of this. Along with that, you can apply other like additive measures are there. Like you can take a biotin tablet. You can take minoxidil for some time. Actually, it's supposed to be used for a lifetime.
Minoxidil,
Once you start minoxidil, you cannot stop it. Then hair transplant is an option if the baldness is to a greater extent after stage 3 and 4. Then hair transplant is an option then.
Okay. But anything you can do to arrest the baldness apart from biotin and stress control?
Minoxidil, finasteride.
Okay. Dietary wise,
anything which is more and more rich in proteins, amino acids, less in carbohydrates and fats. Generally, that will definitely help.
That will help you. So, doctor, there's one facet of you who is the doctor into skincare and hair and all of that. There's another facet of you who is also into the actual creative space, which is theatre and the performing arts. So, tell us a bit about that.
So, when I was a kid, I did theatre back in Bangalore. And then I did few TV advertisements in Bombay as well.
Okay.
I did few poster ads also. What happened is after I entered my 10th and my 12th, my parents were like fixed. You finish your studies and do whatever you want.
I think they're very sensible.
You're not going to do anything on the creative space without a background, without a plan B.
Plan B. Yeah.
So the plan B was quite strong. I did my MD only. So then now you can take a call if you want to take up any choice, but not without a solid background. Sometimes I do feel that they made the right decision for me, that I took up this. So even if my acting or my this whatever it is, if it works out well and good, if it doesn't work out, I still have something I really love. It's not something my dermatology is my second love. No, I love them both equally.
Okay.
I love my work. So acting and theatre and something comes a little naturally to me. I like doing it.
Okay.
So I'd like to keep that as a hobby as of now because I don't have that much time to give it. But I'm planning on opening my horizons on that aspect as well.
So you're going to get into acting in plays and into whatever comes your way.
Yes.
All the very best for that, Doc.
Yeah,
and thank you so much for taking time out for this. It was very interesting, very revealing. We have not taken many names though. This of
we,
things gone wrong.
we took one name, and there are a lot of people getting the work done wrong, and they are getting done through very top-notch people in the industry, obviously.
Yeah. So maybe
So
I'll add one more
yeah,
question. As a person who's going to get work done,
yeah.
what should you be wary of? The final question.
So first and foremost, who's getting your work done? Firstly,
Hmm.
what products are being used? What are your expectations of the work? Realistic expectations, discuss it with the doctor. Discuss what are the results in 3 months, what are the results going to look like after 6 months. This, if you're going to have a shoot or you're going to have something very close, don't get it done because there could be mild bruising and swelling, which might interrupt with your day-to-day schedule. So if you have something acutely, maybe another 10 days or something, avoid getting your work done. After that, you'll have to ice your face and everything. But I think if you do subtle work, it does help in
Okay.
the long run.
Just be wary of what you're getting done and who you're getting it done from, and make sure that you have realistic expectations.
Yes.
Great. Thank you so much, Doctor, for your time. All the
No
very
problem.
best with
Thank you
your
so much
work.
for having me. Yeah.
Pleasure.